My name is Cindy Anderson, and I'm a professor in the College of Nursing and also a member of the Martha S. Pitzer Center for Women, Children, and Youth. As a women's health nurse practitioner and nurse physiologist, my research has focused on the condition known as preeclampsia. Preeclampsia is a condition that occurs during pregnancy, and most people recognize it by identifying high blood pressure that occurs in the second half of pregnancy. Preeclampsia causes significant risk to mothers and babies if mothers develop preeclampsia, and my interest is identifying who will develop it and how we can manage it and treat it so that we have better outcomes for mothers and their children. My background as a women's health nurse practitioner and a nurse physiologist has led me to focus on changes in the DNA that might be a predictor for preeclampsia. Specifically, it's called epigenetics, where there are chemical changes in the genes that can occur as a result of the mother's condition or other external factors, and also can be passed through generations that increase risk for preeclampsia among children of mothers who have experienced it. I also focus on the future risk for heart disease that results from preeclampsia in both mothers and children, and look for those epigenetic markers that might indicate future risk. It's important to understand the risk for preeclampsia during pregnancy and beyond. In pregnancy, watching for the signs of preeclampsia can help providers take care of challenges and perhaps institute some treatments that result in a healthier pregnancy for mothers and babies. They also need to understand that if a preeclampsia has occurred in pregnancy, there is a significant risk for those mothers to develop heart disease. That includes stroke, heart attack, and even kidney failure. And so by knowing that there is a risk, some preventive measures can be put in place to help reduce that risk and have a better life quality. The challenge with preeclampsia is currently we have no way to know which women will develop it. We don't have any treatment for it, and we don't understand the different types of preeclampsia that women develop. So for me, I am very interested in looking at the basic causes of preeclampsia as the basis for screening tests that can be used in the clinical setting that are meaningful to providers to help manage women that develop preeclampsia. And it also will serve as the basis for potential treatments for women who develop preeclampsia to improve the health outcomes for both mothers and babies across generations.